Hi, my name is Teresa. I'm from Marketing and Communications. Welcome to our Heart Month video series. Today I have with me electrophysiologist Dr. Timothy Shinn. Welcome.
Thank you.
Would you please tell our viewers a little bit about what you do here at Allegiance?
Well, currently I am the only electrophysiologist. In about 2.5 months, I will be joined by Dr. Bipin Ravindran, and we'll be working together once again. We are the heart's electricians.
So when you talk about electrophysiology, what's the difference between that and cardiology?
Well, electrophysiology is a subspecialty within cardiology, which is actually a subspecialty within internal medicine, which is another specialization. So when you compare electrophysiology to cardiology, kind of think of cardiology more as a general contractor concerned with the overall state of the house, or in this case, the heart. We, on the other hand, are the electricians. We wire it up.
I really like that analogy. That makes it easy to assimilate and figure out what you're really talking about there, so that's great. There's heart arrhythmia, and is there a major health risk with that?
Well, certainly. Heart arrhythmias can be very benign. In fact, most of us have some degree of an arrhythmia. But on the other hand, there are other arrhythmias which can result in death or major disability, such as stroke. And the most common heart arrhythmia in the country at this time is atrial fibrillation. And unfortunately, it is a leading cause of stroke.
So there's a study called EP. What is an EP study?
An EP study is where we pass wires into the heart, think of them as electrical probes, and really what we're doing is examining the heart's electrical system. We're making sure that the electrical system is functioning properly, and at the same time we're also looking for abnormalities.
So there's a lot of different procedures that you do. Could you tell us a few more procedures that you would do as an electrophysiologist?
Well, I think everyone's familiar with pacemakers. So electrophysiologists are considered as the pacemaker experts. And pacemakers are for people who have excessively slow heartbeats. The next is that we put in what are called defibrillators. And defibrillators are for people who have excessively fast, potentially life-threatening heart rhythms. One of the most interesting and revolutionary products where actually this hospital was very involved from a research standpoint are what we call resynchronization devices. These resynchronization devices actually can make a weak heart strong again. It helps people live better, live longer, and obviously enjoy life. The other area that we've been very involved with is what are called leadless pacemakers. These are the newest pacemakers on the market. There's no wires. We affix them directly to the heart muscle. Afterwards, there are very few restrictions, and in fact, currently, people with pacemakers and defibrillators are able to get MRI scans.
That's really amazing. It's amazing what our technology affords us these days. We have a clinic called an fibrillation clinic. What services are provided there?
Well, atrial fibrillation, first of all, is the most common abnormal heart rhythm in the country right now. Millions of people are affected, and millions more people are diagnosed with this condition every year. Unfortunately, a lot of the time people are admitted to the hospital with atrial fibrillation, and we're finding out more and more that sometimes these admissions aren't necessary, and we try to keep people out of the hospital. Nobody really likes being here. So the atrial fibrillation clinic is a clinic that we've established for patients who have atrial fibrillation to keep them out of the hospital, to perform expedited evaluations, and most importantly, to educate them about their disease. This is a condition which is multifaceted and requires really a lot of effort by the patients as well as by the doctors and nurses, and it's really about education. Once you understand it, it's not nearly as scary as it can be.
Thank you, Dr. Shinn, for joining us today and helping us learn more about electrophysiology. Stay tuned for more Heart Month video series with our subject matter experts.
Thank you.